So my name is Kat Humphreys. I'm the Programs Director for the Harm Reduction Action Center. We're Colorado's largest public health agency working with people who inject drugs. And a little bit less fancy of terms, we're Colorado's largest syringe, Colorado's largest syringe exchange. So I am here tonight to talk a little bit about Fentanyl 101, what it is and what it simply isn't. So to start off with, as you can see from our slides, fentanyl is an extremely fast-acting synthetic opioid analgesic, about 50 times stronger than heroin and about 100 times stronger than morphine. But what does that actually mean, right? So an opioid is a type of drug that's derived from the opium poppy or is synthetically made by a pharmaceutical manufacturer. They slow down your central nervous system, and that means you stop breathing. So an opioid overdose is actually just respiratory depression, right? So someone is no longer breathing. Excuse me. So just to clarify, drugs that are not opioids that sometimes people do get a little bit confused about include benzodiazepines, you might have heard of that, Xanax, Valium, stimulants such as Adderall, cocaine, methamphetamine, and alcohol. Some of those are depressants, some of them are stimulants, but none of them are opioids. But you will hear them in combination with a lot of conversations around fentanyl because sometimes fentanyl is being found in these drugs in some places. So why is this relevant? Why do people care right now? This is a little bit of information from the CDC, so if you're interested in finding more numbers, you can check in with them. But more than 399,000 people died from overdose involving any opioid between 1999 and 2017. So it's a really large number. There are three distinct waves in which we saw this kind of hit. One was in the mid to late 90s with the prescription opioid first wave. The second began around 2010 with another wave of overdose, more closely associated with heroin. And then the third wave, and what most people are very familiar with at this point in the United States, began in 2013 with an increase in overdose death involving synthetic opioids, like the one we're discussing tonight, fentanyl. So, a really important distinction when it comes to fentanyl is how it is manufactured. There are a couple of different ways and routes, and so legally manufactured fentanyl and illegally manufactured fentanyl are two very different beasts. So legal forms of fentanyl are usually found in prescription patches and prescribed to people to treat severe and chronic pain. Illegally manufactured fentanyl usually comes in a powder form. So we talk about this because the difference is really distinct and important. Because legally manufactured fentanyl, especially fentanyl that's coming in patches, is actually transdermally absorbed versus powdered fentanyl, which would not just be absorbed transdermally. And what I mean by transdermally is through your skin, through touching, right? This powder form of fentanyl is you're not gonna overdose if you're touching it, whereas if you were to put on a fentanyl patch, you could absorb it that way. That is the way that it is designed to be absorbed. A lot of people spend a lot of money designing a process where it could actually be absorbed through your skin. That doesn't just magically happen. So fentanyl and non-opioids, as I just alluded to, there are reports that there are a lot of substances coming up positive for the presence of fentanyl or fentanyl analogs across the United States. We've seen this prevalently in cocaine, crack cocaine, methamphetamine, and impressed pills, such as MDMA and particularly benzodiazepines. There are also, I want to explain what I mean when I say fentanyl analogs. So these are drugs that are similar, butylphenyl, acetylphenyl, sufentanil, and something you might have heard of before is carfentanil. It's just an analog that's used it was intended for veterinary use, but that's about 10,000 times as potent as morphine. So as you can see, it just kind of exponentially increases with its potency, and there are all sorts of analogs available that are associated with fentanyl. So it's not just fentanyl that we're talking about here. There are also a lot of analogs. So then that kind of begs the question, what can we do? And that's sort of when harm reduction comes into play. So if you're not familiar with what the concept of harm reduction is, it's really just a set of practical strategies to reduce the negative consequences associated with any type of behavior. But in this context, we're talking about drug use. So just as an underlying kind of piece of information for people to understand, if you're trying to relate to someone who's using drugs, and perhaps you can't, to kind of think of it in the mindset that drug use is often a coping mechanism for people who are dealing with systemic marginalization, and abstinence is not the answer for everyone. Harm reduction, as a principle, meets people where they are in the continuum of drug use, and it doesn't set unrealistic expectations for people without the resources to meet them. Harm reduction can extend an olive branch to someone in chaotic use, and will connect them with much needed resources. And I just want to emphasize again, harm reduction does not expect or require abstinence. So I'm going to go into a few different just statements about harm reduction. So kind of bear with me for a moment, because I know this can feel a little bit repetitive, but I would like for you to really kind of think about these as I say them. Harm reduction is pragmatic. It respects individuality. It focuses on risks and prioritizes goals. It recognizes that drug and alcohol consumption exist on a continuum. It's tolerant and accepting. It's about empowerment. It's not the opposite of quitting. So like I said, harm reduction is really just a set of strategies to reduce the negative consequences associated with a certain behavior, right? So we have a lot of other examples of harm reduction and what that looks like. Not all of it's associated with drug use, right? Nicotine gum for people interested in quitting smoking cigarettes, right? Seatbelts for people who are interested in driving cars. Airbags, designated drivers, sand and playgrounds. Housing first, condoms. These are all examples of harm reduction. So we're taking that concept and applying it to fentanyl and people who are using drugs that have fentanyl in them. What do we do? What does harm reduction look like? Some people get a little scared of what harm reduction looks like when we're talking about fentanyl, because they are unaware of what you could do to actually realistically lower the risk when it comes to using it. So we know one way to reduce the risk of fentanyl is community distribution of naloxone to people who inject drugs and those close to them. So I'm a homeless service provider. I'm somebody who carries naloxone, right? That's just harm reduction, because I'm close to people who are at risk of overdosing every single day. Drug checking to determine the presence of fentanyl, right? That's a way to determine whether or not the substance you're about to use is a safe supply for you. Snorting or orally consuming a substance, if somebody was previously injecting, be a good example of harm reduction. Using less of that substance, if you find out that it does contain fentanyl, if that's just going to be too strong, or all sorts of different things, such as pushing your plunger a little bit slower if you're injecting, and assuring somebody has naloxone around you if you are going to use a substance with fentanyl in it, or that might have fentanyl in it. It's always a good idea to have someone around. And then if it's not something that you're interested in changing about your own personal use at this time, you can always share the results of drug checking with your friends. So any combination thereof would be considered harm reduction for people who use fentanyl. So been kind of alluding to drug checking. We have the tools to do minor drug checking through some urine analysis strips. So they're now being utilized to check the residue of people's substances for the presence of fentanyl or fentanyl analogs. So we pass these strips out, people go forth and check their drugs and see what it contains, right? So when harm reduction education is provided to people who inject drugs, they figure out how to minimize the risk that's associated with fatal overdose. And I just wanted to include a few statistics, because we've been collecting information for over a year. We have hundreds of results. And first of all, 99% of the people who are using the fentanyl checking strips, where I work at the Harm Reduction Action Center, feel that using a testing strip better protects them for making good decisions about protecting themselves when using drugs. 91% of participants who reported finding positive results took some kind of action to protect themselves or others. And those actions kind of range from all of the different harm reduction solutions I just provided earlier, right? So using less, pushing the plunger more slowly, snorting instead of injecting, ensuring they have someone with them in the case of overdose. So these are all different ways you can reduce the risk of fatal overdose. And then 44% of the people who reported positive results reported either using less or completely throwing away their drugs. That might sound surprising to some people, but people who are intentionally purchasing stimulants and end up finding out that there's a presence of fentanyl in their drugs might not be interested in using that, actually. So it's harm reduction for people who use opiates and opioids. It's also harm reduction for anyone who uses drugs. So I've been talking about community distribution of naloxone. So naloxone, or the brand name Narcan, is an opioid antagonist. So what that really means is that it will replace the opioids on your receptors for a brief period of time. It'll knock them off and it'll be a bully. Make sure they don't stay in there for too long and stop you from breathing. So I've had over 40 years of experience with emergency technicians with the access to naloxone. It's not addictive. There's no potential for abuse. There's no agonist activity when it's taken. It's not a scheduled drug, but a prescription is needed. And it can be administered in a few different routes, most typically intramuscularly or intranasally in just a spray. I'm more of a visual learner, so this is a really good picture that I like to show people exactly about how naloxone works. Those are your little opioid receptors in your brain, and then the opioids kind of fit right onto those receptors, right? So how naloxone works in reversing an overdose is, once it's introduced, the naloxone actually has a stronger affinity for your receptors and kicks some of those opioids off. The good thing to know, though, is it really only lasts about 45 minutes. So a person who has been given Narcan or naloxone needs to be monitored for up to at least a couple of hours. Standard about 4 hours is the procedure in the hospital. But you want to make sure that that person doesn't have the naloxone leave the opioid receptors and have all the opioids come back on, right? That's what we're trying to avoid. So what does an overdose look like? Things to look for in an opioid overdose. Somebody is not communicating with you. They are clammy. Their skin is blue or ashen, pale. They're not breathing. They might be slumped over in a really awkward spot, like, hey, I didn't intend to fall asleep here. If you think that to yourself, it might be worth checking on someone to see if they're doing okay. You can always just ask, but if somebody does not respond to you, maybe they're asleep, right? So maybe you just gently rub or touch them just to say, hi, I just want to check on you, make sure you're doing okay. If that doesn't work, what you want to do is administer a pain stimulus. We tell people to do is take your fist and rub it right here on your sternum. It kind of hurts, but it will get somebody to respond to you. If they're unresponsive, that would be the time to administer naloxone. Naloxone will not hurt anyone, and the only real result of naloxone is precipitated withdrawal. So, and precipitated withdrawal is much better than fatal overdose. So, in the case of you're encountering a fentanyl overdose, what we actually say is we switch up our message, which is usually breathe, Narcan, 911. If you can see in this first slide, we have Narcan, breathe, 911. We say Narcan first with fentanyl because of what we call chest wall rigidity, or wooden chest syndrome. You can actually lose the ability to do rescue breathing for someone because fentanyl is so fast acting. At that point, somebody might have to be intubated. So we recommend Narcan first to try to start kicking those opioids off the receptors and then to begin to rescue breathe. Obviously, as soon as possible, designate someone or yourself to call 911. Works a little bit easier if there's someone else there to help you out with it, though, because 911 does like to stay on the phone with you. So if you can find someone, say, call 911. That's your job. And make sure they do it and make sure they get to you as quickly as possible. Do know that the EMTs, especially if you're around here, will have Narcan with them. So you want to give an additional dose of naloxone or Narcan every 2 to 3 minutes as necessary. It can take up to 3 minutes to work. Rescue breathe for the person in the interim. So if you have a mouth shield, that's great. If you don't carry one on your keys like me, then you can just tilt someone's head back, pinch their nose, and start to breathe, right? This goes into great detail, but you can just pull in your air, breathe in to them, make sure everything's sealed, pinch their nose. It's the tricky part. Sometimes it just comes right back out their nose. And then you repeat that breath every 5 to 10 seconds. Eventually, usually people will wake up once the Narcan has had time to kick in. And then when they wake up, tell them what happened. Introduce yourself. Let them know that they're doing okay, right? I think that's a step that a lot of people tend to miss. So now that we know how to respond to an opioid overdose, I wanted to address a few common myths about fentanyl. There's a lot of fentanyl hysteria in the media these days, and so I wanted to touch on a few of the most common myths that I come into contact with. And that first myth is that naloxone can't reverse fentanyl overdoses. Naloxone definitely can and does reverse fentanyl overdose. Naloxone's an opioid antagonist, works to kick off all the opioids, as I've mentioned. That includes fentanyl. Excuse me. It will still temporarily kick them off the opioid receptors. So the time period that you have to respond is a little bit shorter, but naloxone does work. So don't be fooled, always carry your naloxone. It will work even in the case of a fentanyl overdose. Myth number 2, there is a fentanyl analog that is naloxone resistant. Again, some fentanyl analogs are stronger than others. Like I mentioned, carfentanil, super strong. If you remember, one of the Jurassic Parks, I think they use carfentanil on the T-Rex. So we've had this in our culture for quite a while, talking about these opioids. They're super strong, so some of them are even faster acting, but you still can use naloxone on any of them. You might need to use it faster, you might need to use more, but largely naloxone works against all opioids. You don't have to worry about any naloxone-resistant opioid, especially fentanyl. Myth number 3, and this is probably the biggest myth that I see in the media today, is that people can overdose from touching fentanyl. So I went into the 2 different types of fentanyl earlier because it's really important to understand the difference, right? Legally prescribed fentanyl, which is usually in transdermal patches, the ones that they spent, like I said, all those years developing the technology of how your skin could absorb this drug. And then there's powder fentanyl. This is not transdermally absorbed. So it's really important to know that illegally manufactured fentanyl is the fentanyl that is getting put into drugs, right? You can't absorb it by touching it. It's simply not how it works. You have to ingest it, right? Consume it, snort it, inject it for fentanyl to affect you, unless it's in a medical grade patch. Being in the room with an open bag of illegal powder fentanyl or touching it is not enough to result in an overdose. Also, just to be very clear, putting your hands on a person to help reverse an overdose will not result in overdose either. So you don't have to be afraid of this substance. It is super strong and powerful in comparison to some of the other opiates and opioids that we see frequently. However, in this illegal powder form, it's not something that you need to be afraid of being in close proximity with. And then my final myth, just to touch on tonight, is that fentanyl overdoses are inevitable. That is certainly not true. People build and develop tolerances, and that's simply how your body reacts to opioid use over time. There is a smaller margin between an active dose and a deadly dose when it comes to things like fentanyl, but overdose is not inevitable. And just like with many other behaviors that we all engage in, safety planning is essential. So that is all for my part of the presentation, but I'm happy to answer any questions anybody has afterwards.